And in health news this morning, Spectrum Health Integrated Care campuses focus on patient-centered care. And by bringing together multiple services and medical specialties to one convenient location. So here to talk with us about this approach is Dr. Henderson and Natalia. Thank you both for being here this morning. So we were chatting a little bit about this. This is all around the patient. So what's the ultimate goal when we talk about this integrated care outlook?
The real goal is really to surround the patient with a team of providers, be that our wonderful specialists or our primary care, but also the ancillary support that needs to be there to care for our patients. You know, putting in our labs, our radiology at a convenient place so patients don't have to make multiple trips back and forth. And they can have a kind of like a one-stop shopping, if you would, for care, for access to care. And it's truly their medical home. It's a place where they can come and feel comfortable, be familiar with one place and not have to travel all around the city to get the multiple accesses to care that they need.
Right. Oh, go ahead.
Yeah, absolutely. I was just going to add that it's really about that exceptional patient care experience. We want their care to be convenient, accessible, coordinated, affordable, and we want to offer it at the right time in the right location.
And when we talk about the specifics, like you both mentioned, I mean, it's multiple physicians, doctors they can meet with, but also even down to the parking, you said, bringing everything really to the patients, right?
It's designed actually from the ground up, and Natalia's been a big part of that. How do you get people to that front door, the ease of access, mobility within the space, not only for our patients, but also for staff? How do you make it so, you know, the staff are less fatigued, you know, walking throughout the day, there's paces that they take. All that's taken into account when we design these buildings. So it's a lot of upfront work, but it really pays off in the end.
I bet it does. And so talk about the locations. Where can people find access to this kind of care?
Absolutely. So our first integrated care campus opened in 2012 in Holland. We have a second location on the East Beltline in Grand Rapids that opened in 2014. And we're actually going live with another opening of an integrated care campus in Ionia next Monday, and today is the open house, so we're very excited. Okay, so if people want to get a hold of that and visit the open house, where is that going to be located today? So that's in Ionia on South State Road, and you can look up all the times. It's at 5:30 this evening. You can find us on Facebook, on our website. It's all there. And I mean, you know, healthcare has changed so much over the years, right? And I feel like the focus, we all hope, is the patient. You know, is this the new model going forward? Or do you feel like Spectrum is leading the way in this, and this is the approach now these days? Absolutely. When we thought about designing these locations, we went to our Patient Family Advisory Council and we asked them, what do you value as a patient? And they really responded indicating, you know, we want all of our care team to be coordinated, be able to communicate all under one roof, and we want these locations to be easy and accessible. I mean, things like a canopy, because as you know, we have a long winter here in Michigan. So those things are important to our patients, and we want to make sure that we capture those as we build these integrated care campuses. Yeah, and it sounds like patients were a part of the planning process as well. Definitely. Which is huge. That's an important thing to have your voice be heard throughout the process. Great. Well, thank you both for being here. Appreciate it. We'll have more of their information up on our website, but you can see right there, again, benefits we've talked about today, multiple services at one location, the convenience of this kind of care model for the patients, as well as increased collaboration between providers there. So.